This is an exam question paper, okay? This writing task was there in an exam recently. I can't say recently, maybe January 2020. December or January, this was the question paper. Using the information given in the case notes, write a letter for transfer of care to the patient's new nursing home. Okay. Oh my God. There are three types of letters. Which are they? Referral letter, transfer letter, discharge letter. And this is transfer letter. Why should we identify these three types? Yes, when we write the introduction itself, we may mention, I am writing to refer, if it is a referral letter. I am writing to transfer, I am writing to discharge. What is the meaning of I am writing to discharge? I am writing to refer the patient to you, makes sense. I am writing to discharge. Instead of that, you can say, he is being discharged today. That is also equal to discharge, correct? He is being transferred to your care home. That is also giving the meaning of we are transferring. Ultimately, somehow the meaning of transfer or discharge shall come in the introduction itself. That is the immediate purpose. Okay, so we are supposed to write purpose in the letter. Okay, so purpose is identified by saying referral, transfer or discharge. So I said there are three types of letters mainly in OET. Referral letter, transfer letter, discharge letter. But that is not the end of the types of letters. There can be some other special requests also. If you are just introducing somebody to someone, so I am writing to introduce or I am writing to request your home visits. If you are writing to a social worker, that is not a transfer letter, right? You know the meaning of transfer, right? You know the meaning of discharge. When we write to a social worker, there is no transfer or discharge coming into picture. There is no referral coming to picture. Just because you have tried writing many OET letters, you don't need to use all those by-hearted templates in any writing task you get. If you are writing to a social worker, you write, I am writing to, then look at the request. Okay, I am writing to request your special attention. I am writing to request your home visit. I am writing to request or I am writing to introduce Mrs. So-and-so. If you are writing to introduce. So introduce or request, sometimes if you are writing to update somebody about something, you can update. For example, you are writing to the school nurse. The child was in the hospital and after the discharge child is going back home. Maybe, are you writing to introduce the child? They know the child. Okay, maybe they sent the patient to you. There, if you write, I am writing to update the post-discharge care required for, or I'm writing to update the recent hospitalization of Mrs. So-and-so, sorry, not Mrs. Alvin. Yeah, so don't select any English word blindly. Don't think of any training that you got from AIMS Institute or any training institute. You studied to understand some techniques, that's all. Now, sitting in my class, you understood there are three types of letters. That is the benefit of taking OET training, not for by-hearting any sentences. OET always says, never go for exam without taking a preparatory course. OET also says, never take anything that you learn from the training institute to the examination hall. You understand the techniques, but don't use those sentences in the letter. Because OET is not going to repeat any of the questions. You can't repeat any of the sentences from another question paper to this question paper because the question paper is going to be unique. Okay, you have to tailor the answer. You have to tailor the answer depending on today's question paper. Examiners are tailoring a beautiful question paper for that day. Okay. So mainly there are three types of letters: referral letter, transfer letter, discharge letter. And I have to differentiate transfer letter, referral letter and discharge letter. When it is a referral letter, we are writing to somebody for treating the patient, usually. Yeah, you are writing to endocrinologist, you are writing to ortho, you are writing to GP. So I am writing to refer. Let us consider this is a hospital or a GP's clinic or ENT Yes, you can refer patient to them. Okay. Where is the patient? Let's assume patient is at home. Patient is at home. Who are you? You might be a community health nurse. Community health nurse visited the patient. Patient is not okay and you felt of further treatment required. So you are referring the patient to this hospital, any specialist, any doctor, GP. Okay, so hospital, home to hospital. Okay, so let's assume there is a retirement home. There is a retirement home. Patient can go from retirement home to home. Patient can go from home to hospital. Patient can go from home to retirement home. Patient can go from patient can go from hospital to retirement home. Patient can go from retirement home to hospital. These all possibilities are there. One is referral, one is transfer, one is discharge. You understand? Yeah? Hospital to home, that is what? Referral? Simple. Hospital to retirement home? Hospital to retirement home? Transfer? Transfer? It can be transfer if the patient is going to be there full time. Yeah, for long term stay if the patient is going. Patient came from retirement home and now going back to retirement home. Is that transfer? Discharge. Patient got admitted here, now getting discharged. You understand the difference? Patient from home to retirement home. Transfer. She should be transferred to a retirement home. Staying in the house will not be safe for the patient, so we are transferring the patient. She is being transferred to your retirement home for full-time care. So purpose is clear there. What is the purpose actually? Transfer. Full-time care is also there. Yeah. So referral, transfer, discharge. Okay. Don't blindly select. I am writing to refer for all the letters. Okay. It changes from case to case. So I have given you different possibilities. Home to retirement home. It can be community, nursing home also, aged care center, retirement home, anything. Okay. Home to retirement home. Home to retirement home. Sorry, hospital to retirement home. Patient had a chest pain 3 days before. From where? Retirement home. Immediately they shifted the patient to the hospital. Okay, after angiogram, now you are discharging the patient. Patient is going back to retirement home. That is discharge. Patient came from home, was in the hospital for 5 days, but patient is disoriented, restless, agitated, memory loss, non-compliance to medication. Patient is living alone. Now it is not safe to send back home. So we are transferring the patient to retirement home for full-time care. Okay? You understand the difference between retirement home, discharge letter, transfer letter and referral letter? Yeah? So from now, if you write refer, I am writing to refer is okay. I am writing to refer is equal to thank you for seeing as well. If you are writing to a specialist. I am writing to refer, you are going to see him. Thank you for seeing Mr. So-and-so. So I am writing to refer and thank you for seeing gives the same meaning. Sometimes exceptionally, the writing task would ask, write a referral letter to nursing home for further care. Actually, you may feel it is transfer letter, but question paper said write a referral letter. So then don't say thank you for seeing. You are telling nursing home, thank you for seeing my patient. So there you don't need to say thank you for, I am writing to refer. Question paper said referral letter, so you write referral letter. But don't say thank you for seeing. Whom do you say thank you for seeing? Some specialists, doctors. I would recommend. I'm not saying this is the end of the world and this is the only way of writing, but I'm just telling you some ways of thinking. Yes, when you talk to an endocrinologist or ENT doctor, you can say, thank you for seeing our patient, Mr. So-and-so. Makes sense. Yeah? When you tell a social worker, do you want to say, thank you for seeing? No. And it is not a referral letter, so to a social worker also, you don't need to say, thank you for seeing. So referral letter and thank you for seeing is okay. Transfer letter, so you are shifting patient from home to retirement home. You are transferring and they are Accepting. Thank you for accepting is equal to I am writing to transfer. I am transferring, you are accepting. So if you say thank you for accepting, yes, that is a kind of transfer. I am writing to refer. Thank you for seeing. I am writing to I'm writing to introduce or Mr. So and so has so and so problem. He is being transferred to your retirement home. Same thing can be mentioned as thank you for accepting Mr. So and so. You are writing to endocrinologist. Can you say thank you for accepting? You understand the meaning of accepting? See, he is just seeing, and after that, a patient has been advised to do something and sent home. He is not accepting the patient, correct? Is he accepting the patient? Endocrinologist or GP or ortho doctor is not accepting the patient. They are just seeing the patient, advising some treatments. So now we understood we cannot blindly write some English words. Did you write potato or tomato? You did not write because that doesn't suit in this context. It has nothing to do with this sentence. You did not write. Then how did you write accept for a GP? You will think, right? You will think and write. So when you think, same like you will not write potato or tomato elsewhere where it doesn't suit. Same way, any English word that you place, just think and write. He has been advised. So when you write has or been or advised, you will see whether it will suit or not. In the place of instructed, advised, recommended, suggested, you will have lots of vocabularies within your mind and you are selecting the most suitable one according to your knowledge. Correct? So most of the times the vocabulary that we place would not suit, or at least in some cases. So you think properly and you see whether this word suits there. See, you have 45 minutes to write an OET letter. Out of 45 minutes, the first 5 minutes you are handicapped. You cannot touch pencil. That time is just given for reading the question paper alone. You can't even underline. They will not allow you to touch the pencil. During the exam, the first 45 minutes, the first 5 minutes, they are giving you the question paper alone. They will say, do not touch the writing tool now. After 5 minutes, they will say, now you can start using your writing tool. What will they say? Now you can start using your writing tool. Now you can start writing letter, they will not say. Why? It is up to the candidate to decide whether to write the letter. One student will suddenly ask, I cannot plan. Should I write straight away? They cannot say, now you take your pencil and start writing. I cannot use pen? They will ask. See, they are wording things very carefully. Now you can start using your writing tool. Now you can start using your writing tool. You can either underline, you can put cross mark, or you can start writing introduction, or you can go to the back page of the answer sheet and do your planning, anything. You can start using your writing tool after 5 minutes. What to do there is up to you. But I will strongly recommend, go to the question paper, underline, figure out what is not required and what is required, select things, then try to organize, think of a good introduction. If possible, you write it. If the time allows, you write the introduction very quickly. Because this is the area where you are going to spend most of your time. You will write and erase and write and erase. Especially you will have a mental pressure when you are writing the introduction. You will write and erase. Erasing should be proper. Nothing should be visible, right? You are very particular, this area should be erased properly. So how much time you are wasting there? Instead of that, you go to the last page of your answer sheet. There is an empty page at the end, okay, which is not a ruled paper, a blank sheet, which is, I think, not even scanned. They don't assess that page at all. The answer sheet will be a 4-page booklet. First page is to write your name, register number, signature, your photo and all will be there. You will start writing from here, and also you can write here. These 2 pages are only scanned, I believe. It can go in 1 page on the photocopier. Then the last page is empty. You are not allowed to write, and it is printed here, not assessed, not marked beyond this point. You get me? So whatever you write should be within this. Suppose 2 paragraphs are totally wrong, but you have enough time. But 2 paragraphs are totally wrong and you reach somewhere here and you started continuing writing from here and you went to the last page. No, that will not be assessed. Clear? And that page is for rough work and you can do the rough work there. So during the first 5 minutes time, you are not allowed to touch pencil. After that, when you start preparing, if you can write your introduction, you write. Then do a planning. Don't write the complete letter once and then transfer it to the answer sheet. That's a mistake. You cannot save your time there. So think of your introduction. When you are writing your introduction on the blank page, you are not with a mental pressure because it is a rough paper. Do you need to erase it? There was a mistake. Do you need to erase it? It's a rough paper. Strike it off. Write again. Now you are happy with the introduction? Transferring the same introduction to the answer sheet takes how much time? A girl writes an average of 30 words per minute. And boys, maybe exceptionally, there are people who are fast. Otherwise, they also write 25 to 30. Girls write 30 to 35 words per minute. You check your handwriting. Take 3 minutes of time and write something continuously and you check how many words you write. 30 words you can write comfortably. Okay, so ideally for writing 180 words, you don't even need 7 minutes. For writing 180 words, 7 into 30 is 210. Actually, the actual writing time is 7 minutes and you have 40 minutes for writing. What are you doing at the rest of the time? You are not even finishing your letter, right? Yeah, what are you doing the rest of the time? Erasing and rewriting? Yes, in one side that's a fact. And what else? Planning, thinking. So can you imagine how you write your OET letter? You will think looking at the sky. You got the idea? Then the writing is so fast, right? When I said 30 words per minute, you thought, no, we have to think and write. No. When you're thinking, you are thinking. After thinking, the writing is very fast. Can you imagine? Same like how you write the answers for listening. You are very fast while writing. Then again you will think. After getting the words, you will start writing. While writing, you are very fast. That speed is 30 words per minute. Okay? But now you think, if that is your speed, where is the time going? You are erasing and rewriting. That is where the time goes. If you had a proper planning, that erasing and rewriting, thinking of paragraphing, highest time is spent on thinking. Thinking on what? You are always thinking on, see, I'm not generalizing, but I'm telling which I see commonly. I know you are spending a lot of time on connecting words in addition to that. So you are ending the previous sentence to write the next connecting word. Actually, you are not writing the suitable connecting word. You are thinking of a connecting word, then how to finish the previous sentence you are thinking. Or you ended a sentence and then thinking of the next connecting word. It is not necessary that you should have connecting word for all the sentences. Maybe 2 or 3 or 4 connecting words are enough, and that too not necessary. This is an area where you waste a lot of time thinking of connecting words. The other area you are spending a lot of time is alternate words. You are looking for English vocabularies to impress the examiner. Don't do that. What is not there in the question paper, mobilizing. You are thinking and finding out ambulating. See, mobilizing to mobilization or mobilized, these all are accepted. That itself is proving your English. Okay, so vocabulary does not mean writing complicated, bombarding English words. Yeah, they are just expecting, don't copy exactly as it is there. Ambulation, ambulating, ambulation, ambulating, you can write. Mobilizing, mobilated, mobilization. He has difficulty in mobilizing, you can write. Yeah, he is mobilized. Mobilized or resistant to mobilize. And you may say mobilized, mobilizing, mobilization. That is also okay. Particularly what they aim by saying vocabulary is, if you are writing to an endocrinologist, if you are writing to a common man, if you are writing to a social worker, if you are writing to a gynecologist, how you select the medical terms or technical terms in an easy way. Okay, the wordings that you use for endocrinologist will not be the way you will communicate the same problem to a gynecologist. For some people, technical language is clear. For others, it is not clear. So when you are thinking of vocabulary, you are all trying to impress the examiner by writing an alternate word for each and every word in the question paper. Not required at all. And that will affect the smooth flow of reading. The reader's speed will be affected when you are trying to impress them with some vocabularies. And that is not the natural way of communication most of the times. Don't just get into the practice of following IELTS preparation. In IELTS, it was a different type of writing, but in OET, we are trying to communicate something to our colleagues. To talk about a patient. Your job is just to inform something about a patient, not to impress the examiner. So don't bother much about vocabularies. Okay? Don't bother much about connecting words. Time should not be spent there. Do a proper planning. You got a question paper, read the complete question paper and close your eyes. And now you don't remember. See, don't look at the question paper again. Okay, you read, I'm not asking you never look at the question paper, you have to whenever required. But to get a clear picture and organize the structure, you have 7 marks for organization and layout, no? To get the 7 marks for organization and layout, the easiest way is reading the question paper, closing your eyes. Same like a patient is coming and giving their problems to your doctor and you are just standing there and observing them. You heard them for 10 minutes and after that, you know each and everything about the patient, but not in the order that the patient said. You are organizing those thoughts in your own memory, in your own order. Maybe if she spoke about a wound, you know when that wound occurred, how that wound occurred and what medication was taken currently, what is the condition and what is next. Patient also said she has headache. Maybe while talking to the doctor, she started with, I have 2 problems. One is headache, the other one is having a wound on my right leg. Then she mixed up things, headache and wound. Both she mixed up while talking. But when you are recollecting the problems of the patient, you are putting things in your own order without bothering about what she said. You don't remember the order, but you know what is her problem, what are the medications taken, what is the current condition. And you got a style of writing in your own way because you are not overly depending on the question paper. Don't overly depend on the question paper. Just read it, you remember everything. Did you work yesterday? Do you remember any of your patients? So you remember your patient? Okay. But you don't have patient's case file with you. Still you remember, correct? What is her problem? When did it start? What is the treatment given? What is the current medication? What is to be done next? Everything is in your mind. Not just one patient. You may have 5 or 6 patients in your brain today. Yesterday's and day before yesterday's patients you remember, yes or no? The basic requirements, basic problems, solutions, everything is there. Is it in the order of case notes? No. In your own style, in your own order. Keep that order in mind. So if I ask her to write about her patient, she will not follow the order of the case notes. Maybe in the case note also, it is to an extent written in the correct order. But when it comes to OET exam question paper, they are very smart. They will not keep in the order. They will keep the latest information sometimes in the middle. They will mix up things. They will talk about ambulation in the beginning, they will talk about ambulation in the center of the question paper, and they will talk about ambulation in the discharge plan also. But with our common sense, we will put and we will segregate them together. It's not just about her. Everybody had a patient either yesterday or day before yesterday, if you are working. But you remember all the problems of the patient. If you have 10 patients also, you know about them. You know about their basic problems. Maybe in depth each and everything and family and their age and date of birth you don't know. Not necessary. Even in OET, such kind of in-depth information is not required. Without telling that itself, we have sufficient content to write 180 words. And that is how the reader wants. Not each and every step of the treatment. After that we gave glucose, then we gave painkiller. That painkiller's effect lasted for only 5 hours. Such details are not required in OIT letter. Post-operatively, don't write all the details of post-operatively. Surgery was over before 7 days. You want to talk about each minute by minute history to the reader? Not required. Okay? As you remember your own patient in the hospital, when you read this question paper, you should feel that patient is telling her problems to the doctor and you are just a listener. Listening to them for 5 minutes, everything is in your head now.